Well, if you're taking an aspirin every day to protect your heart, you may be getting another unexpected benefit.
Yep, a new study finds aspirin may also help protect against colon cancer. Dr. Zorba Paster joins us from his clinic in Oregon. Hi, Zorba.
Hi, good to be here.
Good to see you. So tell us about this study. What's the connection between aspirin and colon cancer?
It's a very interesting study. A number of years ago, we discovered that people who took aspirin on a regular basis generally had fewer polyps. Some of the polyps in the colon cause cancer, some of the polyps do not. This was from the Nurses' Health study, big study. And so there have been a number of other studies that are now going on, and the latest research seems to show that taking an aspirin a day may significantly reduce colon cancer. The latest study shows that some people it reduces it in and others do not. We don't have the exact genetic predisposition, but I think an aspirin a day, if you tolerate it, or an anti-inflammatory, may be the thing to help reduce your risk of getting colon cancer at all.
Are there any risks, any side effects to taking aspirin, an aspirin a day?
Absolutely, and that's really why there are not general recommendations right now. About 1 in 10,000 people actually get an important GI bleed that may land them in the hospital, and that can reduce problems. And that's really that's sort of the biggest problem that we have with it. And then some people have the inability to clot, and so they can get what's called a hemorrhagic stroke. So if they hit their head on the ground, they bounce their head, they may actually bleed into the brain, and that can produce a problem. But I think these risks are small compared to the benefit. And that's why doing this, and of course, colon cancer screening is very important.
What age do you think this is most important?
Good question. I'm not exactly sure. Probably somewhere around the age of 40, because we know 50 we start screening for colon cancer, and there are 3 ways you can now screen for colon cancer. Number 1, we know about the colonoscopy. It's every 10 years. You've got to drink that fluid, and then of course you have to be sort of put into this twilight sleep. The second way is through this. This is called a fecal occult blood test, and this particular test you do once a year with your doctor. Very successful, almost as sensitive as the colonoscopy. It's easier. And the third thing is the new thing, Cologuard, which comes from Madison, Wisconsin. You take it every 3 to 4 years. It's also very effective. So we've got new ways of picking up colon cancer, and more importantly, we may have, through aspirin every day, a new way of preventing it.
What do you tell your patients just in general about aspirin? So many people out there take that one a day for heart health. What do you tell your patients on a daily basis?
You know what I tell them? I think the benefits of aspirin outweigh the risks. If they're not on Coumadin or another blood thinner, I tell them, take an aspirin every day, very useful. And I start people generally at the age of 40 if they have any risk factors for heart disease. And because there's some data that shows it might even reduce breast cancer, if there's any family history of breast cancer, I tell them to take it. Low-dose aspirin, just as good as a full aspirin, and that's easier to take, easier on the stomach.
All right, very good information. Thanks, Zorba. Good to see you.
Good to see you, Zorba.
Good to see you guys.